years. And we investigated it, but the pandemic kind of messed stuff up. And since 2019, I have heard reports of a total of 5 other litters. And so when multiple litters appeared in 2023, and in Caitlin Schleifer's litter, Schleifer, is that how you pronounce your last name? I think Schleifer. And their litter, they also had 3 out of 6 puppies affected. And Caitlin was very forthcoming with the information, which allowed us to then actually investigate this to determine the cause and try to find out why it's appearing and what we can do to prevent it. So that's kind of how this has started. And we're really pleased tonight to have Dr. Margaret Cassell from University of Pennsylvania. She is a veterinarian and also has her PhD and is a geneticist there. And I will let you introduce yourself more when you get up here. But Maggie has been working with us for about 10 months now on this project, and we're going to fill you in with what's going on. So I just want to talk a little bit about myasthenia gravis. So how many of you guys have actually heard of myasthenia gravis? Okay, so that's a good thing. So myasthenia gravis is a disorder in the neuromuscular junction. Okay, so the neuromuscular junction is what's pictured here, and it's a little blurry. I apologize for that. But myasthenia gravis is a disorder of neuromuscular transmission which defects of the acetylcholine receptors result in muscle weakness. So patients with myasthenia gravis will show premature fatigue, but that fatigue is often temporarily relieved with rest or with an anticholinesterase medication or anticholinesterase therapy. Okay, so when we were all in vet school, we had to learn what all this is, okay? So this is a neuron, which is a tiny, tiny nerve that has made its way. The message comes down from the brain, and it goes down the spinal cord, and it goes into a big nerve and a smaller nerve, and smaller nerve, smaller nerve, ends up on a neuron that is related to a muscle fiber. And this is called the neuromuscular junction. So the nerve impulse comes down through here and is transmitted across to a muscle fiber, and that muscle fiber contracts. So if you think about it, how in the world are you able to actually walk? This happens in millions and millions of muscle fibers in your body, and it happens instantaneously so that you can actually walk. So this is really interesting, and I will tell you, this little enzyme right here, the CoIQ, that's the one that causes problems in golden retrievers. That's just an FYI, and it's a little tidbit that I thought I'd show that out, and it will be on the quiz later. So I'm kind of a simple person. I'm a country veterinarian, and I don't do well with things like this. So I do well, though, with visuals. So I thought, hey, I'll use some artificial intelligence. How can I possibly describe how the neuromuscular junction works? Well, it's kind of like a baseball in a glove. So I said to Siri, Siri, I need some AI, draw me a picture of baseballs and gloves. This is what I got. Okay, this has nothing to do with the neuromuscular junction. I just thought I'd put that out. So I consulted the graphics department at the Animal Hospital at Stewart's Draft, and this is what we came up with. So if you think about it, the release of the impulse from the nerve is in an enzyme called, or it's in a product called acetylcholine. And it comes out in little packets. So it's released from the nerve, and it goes across the little microscopic space, and it goes to the muscle fiber. And so when the muscle fiber gets the acetylcholine, it catches it, and the muscle fiber contracts. So I brought my Hello Kitty pointer. So the baseball, which is our little increment of acetylcholine on our nerve right here, is going to go, the nerve comes down and says, hey, we need to move. the baseball is released and goes over to the glove, which is on our muscle fiber, and that is how your muscle contracts. Acetylcholine goes to acetylcholine receptor, and the muscle contracts. So let's think about it for a minute. There's a couple different types of myasthenia gravis. So how many of you guys have heard of acquired myasthenia gravis? Okay, that's the one that people get. And I put a picture of a golden retriever up here because that's the one the golden retrievers get. The one case of myasthenia gravis that I have seen in my practice of acquired myasthenia gravis was an 8-year-old golden retriever. And she came in not able to swallow. Her esophagus wouldn't contract and she had a mega esophagus. So acquired myasthenia gravis is an autoimmune disease. It's an autoimmune disease that results in the defects of the neuromuscular junction. Antibodies that are produced by the immune system will bind to the acetylcholine receptor, and it prevents the attachment of acetylcholine. So back to the graphics department at the Animal Hospital of Sturridge Draft. So we have our nerve fiber with our baseballs. Those are our little packets of acetylcholine. So these are our gloves over here, but oh my God, they've got nets and spider webs over them. So nets and spider webs are different types of immunoglobulins that the immune system has decided, you know, we just don't like those ACH receptors anymore, and we're going to make them go away. So what do you think? When the baseball is released, Wesley, if you have a net over your baseball glove, can you catch the baseball? No. So if your muscle needs to catch the baseball to actually work, do you think the muscle will work? If the baseball can't be caught, then the muscle won't work, right? Okay, so that's how acquired myasthenia gravis causes the damage. So now we're going to talk about congenital myasthenic syndromes. Okay, so we always laugh. A syndrome is something that you don't exactly know what causes it, you don't exactly know how to treat it, but you don't want to call it a disease, you call it a syndrome. So we refer to this as CMS as opposed to CMG. But this is a hereditary disorder of the neuromuscular transmission resulting in structural or functional defects of the neuromuscular junction. Okay, remember I talked about that we found the actual cause of congenital myasthenic syndromes in golden retrievers, and that was that tiny little COIQ part of the receptor that's defective. So CMS has been reported in the literature in Jack Russell Terriers, Smooth Fox Terriers, the Heidi Terrier, which I guess must live in Germany. Did y'all remember the movie Heidi from Germany? Oh, Switzerland. Oh God, I'm so stupid. Okay. It's also been reported in Labrador Retrievers, Golden Retrievers, English Springer Spaniels, and the Old Danish Pointing Dog. It will soon be reported in, well, we hope it'll be reported in Sillingham Terriers. As much as we hate to admit it, our goal obviously is to publish this information. Okay, so we don't know exactly what's wrong, and we were ever hopeful that the biopsies that we did recently would tell us, but they were inconclusive. But we know that congenital myasthenic syndrome is a defect in the receptor somewhere. So our graphics department, we still have normal acetylcholine. We have our baseballs. So when the nerve fires, the baseballs are thrown over to the receptors over here. But Wesley, what do you think? What about this baseball glove? Does that look like a good baseball glove, or is it broken? Yeah, it's broken. It's missing like 2 fingers in the webbing, right? How about this one down here? What do you think about that one? Yeah, it's broken too. It only has a thumb and a little bit of webbing. Now, there is a normal one right there, but the others are defective. So, will this glove catch a baseball? No. But this one might. How about this one down here? Will it catch the baseball? No. So if you have to catch the baseball for your muscle to contract, odds are it's not going to contract. It might contract a little, and maybe with rest, this one will catch enough to make up for these others. But that's how congenital myasthenic syndrome works. The acetylcholine is there, but the receptor doesn't work. Does anybody have any questions? Okay. And I didn't hear anybody laugh at my artwork, so thank you. Do appreciate that. Yes. So the acquired myasthenia, it's an autoimmune disease. And that's what happens in people. In people, there's lots of good treatments. Most of them are something called monoclonal antibodies. But what you have to do is stop the immune disease. If you stop the immune disease, technically the baseball gloves are still there, but they're just being hindered by the nets and the spider webs. Right now, to my knowledge, and I'm not a specialist, but unfortunately in Goldens and in dogs with acquired myasthenia gravis, we often try to treat them with immunosuppressive drugs. It typically doesn't work. It's been several years since that Golden was in my practice, and she died of aspiration pneumonia pretty quickly because she wasn't able to swallow properly. Okay. So what we are finding as breeders and as veterinarians, the clinical signs of CMS, and I've got a picture of a Sealy, but this is reported in any CMS. The first thing that you're probably going to notice is some lameness, some bunny hopping in the rear end. Frankly, my first thought with my litter was, how in the world does this puppy have hip dysplasia? Because that's how dogs do bunny hopping. They do hip dysplasia, they bunny hop. The second thing that you're probably going to notice is some front limb lameness, but it's not always the same leg. But it's almost like we stumble just a little bit. And then the puppy will rest for a minute and they get better. Exercise intolerance, premature fatigue that's relieved by rest. And this is really interesting. See the Sealy sit up here? There's a textbook that I have that has a picture of a Siamese cat sitting like that. And it was a Siamese cat that had myasthenic syndrome. That's how you don't fatigue your neck muscle. If you sit straight up and down, your spine will hold your head up. But when you sit like a normal dog, your head will get fatigued. That can be a little tricky in our breed because I don't know about you guys, but my Sealies love to sit like that, especially if you give them a cookie. But this will happen in puppies that are really young and almost like you're thinking to yourself, wow, that's interesting. I've never had one do this early. So what we're finding is the symptoms appear at the age of weaning. Our experience has been anywhere between 8 and 12 weeks of age. So I'm going to show you a video real quick. One of the things that we want for you guys to do as breeders, we need for you to really, really watch your litters, okay? Really watch them. So I'm going to show you 2 videos here real quickly of what this puppy is about 12 weeks of age with his litter mates. Brenda, that's Maddie. Okay. Do you want to see it again, or did you see what you needed to see? You're good? Okay. Well, then maybe I'll try to. So here's a more recent litter. Brenda, this is Kelly. This video was taken in March. And this puppy's 13 weeks old. They have different parents? Yes, they do have different parents. So that's after she's been out in my yard playing for a little while. 2 weeks earlier than that, you probably wouldn't have noticed that. I noticed it because I was looking for it. And I noticed it when she was playing in the house with her brother and with my kitten. So how do we diagnose CMS? Okay, I'm not going to lie to you. I had actually sold Maddox, the puppy that was in the first video, to a breeder in Idaho. And she called me and she said, well, let me back up. He had started limping a little bit before he left. And I called her and I said, something's up with this pup. He may have hip dysplasia, but I've x-rayed him and I don't see anything. And she said, well, we've already made our plane reservations. We'll take him home and take him to our vet. And I said, well, if you have any expenses, let me know. So she took him to her vet, and her vet said, I think this puppy has congenital myasthenia gravis. And they called me, and I went, oh, I've never heard of that. I'm an old school veterinarian. I've never heard of that. But as soon as I hung up, I immediately started reading about it, and I called her back, and I said, I'm really sorry, but I think your vet's right. What year was 2019, actually, well, it was in 2019. It was in November of 2019. So I ended up getting the puppy back, and that video was made about 2 weeks after I got him back in November of 2019. So when you take this puppy to the vet, you may have to say to them, I think this could be Myasthenia gravis. And I hate to say this, but your vet's probably going to go, really? You think so? Because it's very, very rare. I took my puppy to Virginia Tech, and the neurologist wanted to argue with me over it. And I thanked them for their time, and I said, oh, by the way, can I have your PubMed password so I can log on and read about it myself? And anyway, that's how we went on. So you're going to take the puppy to the vet, and you do need to do an appropriate workup. X-ray the puppy and make sure the joints are okay. Make sure the pelvis is okay, that it's not hip dysplasia, elbow dysplasia, or something else. Run some blood work on the dog. If this dog has potassium deficiencies, they will probably walk funny. If their calcium's off, they may walk funny. But odds are the exam's going to be normal. We want to run an acetylcholine receptor antibody test. That's how you diagnose acquired myasthenia gravis. And it's a test that looks for the antibodies. The best place to do that is at the Comparative Neuromuscular Laboratory at the University of California, San Diego. Dr. Diane Shelton runs that lab. She's been doing neuromuscular research for 30 plus years. She's a good colleague of Dr. Cassell's, and we've been working with her. That is likely going to come back normal. Yes, Lisa.
Would there be symptoms to see before this puppy goes home to a new owner, and you're asking this new owner to take it in for an exam? Would there be some hints?
So we're gonna touch on that just a little bit, but the answer is it depends on when the puppies leave. And I'm gonna give you a couple of hints on what you need to look for. In the Schleifer family, y'all had noticed it early. I noticed it in my first litter. The puppies were born at the end of July, and I noticed it at the beginning of October. So they were 10 weeks old. In the second litter, the puppy was 12 weeks old before I noticed it. Now, my advice to you as a breeder, play with those puppies. Make them run. Let your cat chase them. Open your door and let them run in your living room and play. That is when you're going to see it, because they need to run to fatigue. You have to work them until they fatigue before you're going to notice it. And I encourage you to hold on to your puppies until they are closer to 12 weeks of age now. We want you to document this with good quality videos, okay? And it takes two people to make a good video. You've got to have a videographer, and you need someone out there to get the puppy to move, to play. So get somebody to help you, but we all have our awesome Android and iPhones now that you can make videos with. And we want you to document it. Make sure you get copies of your vet records, get copies of the test results. You don't need to go to a neurologist to diagnose this. It's going to be diagnosed on clinical signs. That being said, we have had these dogs go to neurologists. There was a litter that the owner happens to be a veterinarian, and she was at the university at Colorado State. So their neurologist saw one dog. The neurologists at Cornell have seen a litter. The neurologists at Virginia Tech have seen them. And there are other tests that you can do where you do electrodiagnostics, where you stimulate the muscles to contract. You can take biopsies. And then there's also something called a tensilon test, where you actually administer something that keeps the baseballs in circulation for a longer period of time. It's called an anticholinesterase inhibitor. But if you think about it, it just keeps those baseballs hitting glove, hitting glove, hitting glove, hitting glove. And eventually, if they have myasthenia, you will see a little bit of improvement for a very short period of time. But we need for you to document it. And then obviously we want you to reach out to the health committee. We need to know, because then we're going to ask for DNA samples. So again, just to kind of speed things along, our health committee is aware of 8 confirmed cases in Sealyham Terriers in the US and Canada. These puppies are from 4 different litters, and this is since 2019. We have anecdotal reports of at least 3 other affected dogs, but one owner declined to participate in the study, and the other dogs were never truly diagnosed with video footage or veterinary evidence. This is not the same thing as a swimmer puppy. A swimmer puppy is a tiny little puppy that can't get their feet and legs up under them and they look like they're swimming. It's not the same thing. These puppies, in general, don't look like swimmers. They more or less look like normal puppies until they start becoming weak. So of our litters, litter A, we had 6 puppies that had 3 that were affected. And I've just kind of in my head clarified, 2 were moderate, 1 mild. Litter B also had 6 puppies in it, 3 of which were affected, 1 severely affected, 2 moderate. Litter C, there were 5 puppies, of which 1 was affected. In litter D, there were 2 puppies, of which 1 was moderately affected. So, outcome. What are we looking at? Because this happens. It's happened to me twice. It's happened to Caitlin. And I've already pointed at Brenda sitting there in the back because 2 of my affected puppies live at Brenda's house. One of them, you'd never know he was ever been sick. The other one is only 9 months old, and she is starting to show some signs of improvement. The literature shows a poor prognosis. So as I was doing some research on this, I really only found a couple of publications. The litter of 4 golden retriever puppies, they were all euthanized because of their symptoms. And the 1 Jack Russell Terrier puppy was also euthanized. In our experience, for the most part, these dogs do okay. Litter B, the severely affected dog, because of his weakness, developed other abnormalities in growth and in development. And he was humanely euthanized, and we were able then to study his body to learn more about what was going on. But in litter A, 2 of the 3 puppies, you would never know anything had ever been wrong with them. One of them still favors it a little bit, but she has already earned 3 scent work titles, so she obviously can get around. In litter C, this dog lives in Canada now. That she's 17 months old. She's definitely doing better. Litter D, puppy is 9 months old, and again, we've gotten reports from her owner that she can see improvement as well. So my caution to you is it's not a terminal thing. If you have a puppy that's affected, don't give up on the dog. Don't give up on the dog because it will most likely make a wonderful pet. So in my 2019 litter, I did rehome that dog. I kept him for over a year. And this is a video of him. He is the second dog. This is him at 18 months of age. And he's the second dog. Oh, I don't think he's hopping at all. Watch him run. This is... Watch him. This video goes on for about a minute. So watch the bitch in front of him, and then he'll take his toy. But he is markedly improved over the first video. So he's now 5 and lives a very normal, healthy, happy pet life. So the answer is yes. Scott asked about medication, and I failed to put that in. There is a medication called pyridostigmine or Mestinon. And Mestinon is an anticholinesterase inhibitor. So again, it just keeps bombarding the baseballs at the nerve. Some of these puppies have been on that. We've seen some that maybe it helped, others that it didn't help at all.
It helped them very early with the megaesophagus, and then it kind of plateaued for a while, and then it ended up making it worse.
So that was Caitlin's puppy that was the most severely affected. Okay. Now, at my home, I felt like it helped at least some. But Mestinon comes in a 60 milligram tablet, and the dose is 1 to 3 milligrams per kilogram. So in small puppies, it's somewhat hard to dose, and it became very expensive too because you had to have it compounded. Yeah.
I have a question.
Yes.
You discussed the percentage incidence of also megaesophagus along with it, and what that is, people that may not know, and how to treat that.
So in general, our experience has only seen megaesophagus in the most severely affected dog. None of the puppies that I've had, all three of yours had megaesophagus?
Not as bad with Tammy, but the Buttercup and Roberts, yeah. And
Okay.
in the Facebook groups on CMS, a lot of
Okay.
them have megaesophagus.
Well, and that is certainly possible. In my litters and in Alex's litter, we did not have megaesophagus. That being said, I actually have a puppy that's a dachshund that has a megaesophagus. So again, the deal is that smooth muscle does not contract to force food into the stomach. So the way that you deal with that is that you always feed the puppy in a vertical position so that gravity will carry it to the stomach. Some dogs do great, some don't. In the acquired myasthenia, because that presents with megaesophagus, often those dogs develop aspiration pneumonia because food goes into their lungs and they die from it. And that would be the one thing that I would tell you, that, again, with these puppies, there's always complications that can occur. And aspiration pneumonia is a very serious complication that can, lead to really bad circumstances. So it is something that we have to be aware of. And like we were saying, I'm trying to be optimistic and tell you not to euthanize puppies the instant that you diagnose it. But I'm also sitting here looking at a family that went through a horrible loss and at their home, and they're going to tell you that their experience has been totally different. And, again, as we talked when this first started, we were being very encouraging to give them a chance. And I guess as part of my just nature, I'm the world's best optimist that always want to give them a chance. And that's what I try to encourage folks to do. But I also can tell you that it doesn't always turn out well. Okay.
Just real quick, does that imply you think we didn't give these dogs a chance?
Not at all. I didn't say that at all. I didn't say that at all. No, sir, I did not say that at all. If anything, I commend your efforts, and I spoke with Caitlin many, many times to encourage her to give her dogs a chance. But I also, in speaking with her, as the dogs deteriorated, it comes down to a quality of life, and I'll be the first one to come over there and hug you and tell you that I'm right there with you, sir. Okay, and I'm sorry. And I'm sorry. You did everything that you possibly could and more, and it just didn't work out. It just didn't work out.
The general consensus in our community is you guys went above and beyond.
Yes.
And we
Absolutely.
are so happy.
Absolutely.
We are so happy with Caitlin's fervor and her bravery of exposing what was an underlying problem and people were not addressing.
So,
and I want to say we feel like you guys rode the storm out, and we commend you.
we wouldn't be where we are right now if it weren't for you. Okay, we would not be here now. And in 2 years, when the test is developed, we owe it to you, because yes, we talked about it, but nothing was being done. And your family and your wife were the driving force behind making sure that something got done. And we really do appreciate it. So in no way do I ever want to imply that you did nothing but absolutely your best to do everything that you could for your dogs and for our breed. Okay, thank you.
And to be clear, I'm not looking for any credit for this, but I just don't know if everyone really has an appreciation for just how awful it is having these dogs at home like this. Like the mega esophagus thing and the feeding the dog vertically, just think about what that means to have to feed a puppy vertically, 3 puppies vertically, multiple times a day for months.
Yes.
It's insane.
Those
Yes.
of us that are active breeders, we get it.
Yeah.
We absolutely get it.
Very much so.
Raising a puppy that is in good health is hard enough. Is 24/7, and you guys did. You did your best. You were, in some cases, fighting a losing battle, and you absolutely tried your damnedest. And I salute you. Nothing but my commendation comes your way.
Right.
Nothing at all.
We're thankful you can.
Yes.
Because otherwise it wouldn't have been brought out.
So that's where we are with what information that we have now. And I implore you, and especially those of you that are watching this either on YouTube or on Facebook, please, if you have any suspicion at all that you have puppies that are affected with this, we need to be able to diagnose it with a video and with basic veterinary workup. We just need the clinical signs and documentation. And then we need your DNA samples, because we don't need to know the the COIQ. We don't need to know that. We just need to know who's a carrier, who's clear, and how can we stop this from spreading through our breed. So based on that, I'm going to transition over to something that we probably all learned in high school. Yes, Dr. Olton.
I was going to ask, do you think it's a simple inheritance or multi-factor?
So that's a good question. The question is, do we think this is a simple inheritance or not? And Dr. Cassell and I have chatted about this evening, and the answer is we don't think it's a simple inheritance. But I'm just going to explain to you a little bit about what we've got here. So how many of you guys had a little bit of genetics in high school? Okay, so this is just a review. So when you breed two animals together, in this case we're going to call them dogs. So we have the sire and the dam. So the sire passes a gene and the dam passes a gene. So in a litter of 4 puppies, all of them are going to get one gene from the sire and one from the dam. So they're all going to be big old SDs. Okay. So how many of you remember that brown eyes are dominant over blue eyes? Okay. That is an autosomal recessive trait. So autosomal recessive means that the more dominant gene will always be the one you see. Okay. So brown eyes are dominant over blue eyes. So let's say your mama has brown eyes, but your dad has brown eyes, but he carries a blue gene. So if you look at your dad, what color are his eyes? They're brown. So dad passes a brown, mom passes a brown. So child number 1 is going to have brown eyes, but not carry a blue gene. Baby number 2 is also going to have brown eyes and not carry a blue gene. But guess what? Daddy's passing on this blue gene down here. So baby number 3 is going to have brown eyes. Oh, by the way, it's carrying a blue gene, and same here. So this is simple autosomal recessive. The blue is recessive, but guess what? 2 of the 4 children carry a gene for blue eyes. So if this person, let's pretend they're not brother and sister. If this person marries this person and they have kids, what's going to happen? So we've got 2 people with brown eyes, but they're both carrying a recessive gene. So one child's going to, again, simple autosomal. If there's 4 kids, one of them's going to have brown eyes with no blue gene. 2 of them are going to have brown eyes but carry blue genes. Guess what? There's a 25% chance you're going to have a baby with blue eyes. That's what happened to me. I was not fathered by the milkman. My parents just happened to carry blue-eyed genes, and I have blue eyes. I still think my sister was fathered by the milkman because she doesn't look like us at all. But anyway, so we would like to think that myasthenia gravis or congenital myasthenic syndrome would be autosomal recessive. Wouldn't we, Dr. Cassell? Would that make our life easy? It would make our life so easy because, like we just learned with our blue eyes, we would breed a carrier to a clear, and we would get 2 carriers and 2 clears. Does that make sense? The little one is the bad gene. The big ones are the good genes. Well, if we breed 2 carriers together, we have a 25% chance of getting 2 affected genes. This dog's going to show the symptoms of myasthenia. And the problem is right here. How do we know who these dogs are and we don't? So obviously, as I wrap things up, our goal as the American Sealyham Terrier Club is to provide the funding and the means to identify the gene so that we can actually develop a test to identify the carriers. If we can identify the carriers, like what we did with primary lens luxation, then we can stop the affected puppies from ever coming into the world to start with. We don't need this family over here to go through this again. We don't need for any family to go through this again. And we need to find this. It's going to take some time and it's going to cost some money. So our club has been using funds that were pre-approved for health-related things, and we've been able to compensate people for their submission of samples for DNA testing, for the diagnostic tests that they've run, and the veterinary bills incurred in getting the tests that we need. We approached the Sealyham Forever Foundation earlier this year, and the Sealyham Forever Foundation agreed to match donations to the research of this disease up to $5,000, which means if you donate to the American Sealyham Terrier Club and you designate it for CMS research, that they will match it up to a total of $5,000, which means that we could actually sit here tonight and raise $10,000 for this research. So based on that, I'm going to turn it over to Dr. Cassell, because in my mind, I wish we didn't have to spend that much, but I bet we'll have to spend more. We do have a question, Leslie, yes.
So on your screen, when you were showing the Punnett Square, the genetics,
Mm-hmm.
and you said that it would be great to not have this. So yeah, if we know that we've produced a dog has produced an affected puppy, you know he's a carrier. Right. She's a carrier. Right.
Well,
So wait a minute.
Okay.
Because I studied genetics too.
Okay.
I was in DNA research. So the aspect is, and this is what we did with PLO. If you know that a dog has produced affected puppies, you choose to breed that dog or bitch to a line that isn't necessarily connected, that you have a better understanding, it might be clear. You don't keep breeding the same dogs that are producing these litter mates or litter mates of affected dogs. I mean, this is really simple stuff. Yeah.
So I'm going to relay information to you that was explained to me by Dr. Leanne Clark, who is the head of the genetics lab at Clemson University. She is also a colleague of Dr. Cassell's, and Dr. Cassell can address this question as well. I will tell you that all of the bitches that have produced affected puppies, the 4 bitches, litters A, B, C, and D, I know for a fact 2 of the bitches were spayed immediately after those litters were produced. Those litters were not the first litters of those bitches. The 2 litters that I had, one of them was her 3rd litter, and the other one was her 2nd litter. Different sires in the litters. I will also tell you that in my own life, as I looked at that and then started looking at the puppies that I had kept out of those litters, that I've been incredibly diligent, racking my brain and looking at other situations of who has seen this before. Well, in 2019, I was the only person that had seen it before. So when you go out and you breed to something, you don't know because no one has seen it before. Nobody had talked about it. But the anecdotal reports that we get, we don't know. And so when I consulted and had a very long telephone conversation with Dr. Leanne Clark, who is, again, head of the genetics lab, I said, well, I guess I ought not breed any of these dogs. And she said, absolutely breed these dogs. I said, what do you mean? And she said, well, for one, we don't know that it's autosomal recessive. And for 2, your gene pool is so small in Sealyham Terriers that if you stop breeding just for one thing, you're going to end up with no dogs.
Now that contradicts what Liz Hansen said when she came out and presented after the PLL test was found.
So I'm going to defer the rest of your questions to Dr. Cassell, because that's not actually here where we're to talk about. We're talking about the project that we're working on now.
No, it was just about autosomal recessive.
Right. And that's our discussion, is that we don't think this is truly an autosomal recessive. If it were, I can tell you the sire of my first affected litter probably had at least 20 litters of puppies, at least, and no reports of any affected. And like I said, in my own household, the bitch, she produced 19 puppies in her life, of which only 3 were affected, but they were all sired by the same dog.
One other thing to throw in here, and this is something that I know Caitlin dealt with too. These puppies that are affected don't necessarily make it to 8 weeks. They will.
Yeah,
They don't. They are often not good nursers. They need to be tube fed, or they would just stay.
that has only been the experience in 1 litter. The other 3 litters were all normal puppies until they started showing the lameness issues. And the golden retriever puppies that were cited in the literature were presented to the vet at 16 weeks of age for lameness issues.
But again, because we can't test, those puppies may have been the only ones affected in that litter. They just didn't make it because they have megaesophagus. This is something.
Well, that's not what's cited in the literature. And as again, we're looking at what's published and what's literature for scientific purposes. And obviously all of this data will be collected, but that's where we are with this. So at this point, I'm going to turn it over to Dr. Cassell and let her talk. So thank you guys for your attention. Let me get you fired up here. I'll get it. Okay, you get your here.
Yeah,
I have
yeah, that's okay.
150s.
I don't need it.
What? No,
Thanks.
this is for the recording.
Yes.
So just put that on.